Who determines which state health care provider state employees have as a choice?
The Department of Human Resource Management, or DHRM, has the responsibility of administering the state health benefits plans.
Are all insurance provider benefits the same?
No. There are various options under each plan for you to choose from. Your plan choices are dictated based on where you live. Your selection determines your plan providers for you and your dependents. Let's go over these options in more detail. If you live primarily in Northern Virginia, Washington, D.C., Fredericksburg, and parts of Maryland, you have the option of Kaiser Permanente, which is an HMO plan. This plan contains no deductible costs, but limits your network providers to the Kaiser network. Those who live in the Kaiser Permanente locations also have the option of selecting CovaCare, which is a PPO through Anthem, Cova Health Aware through Aetna, and Cova HDHP. All employees who live in areas other than what is shown here have the option of selecting CovaCare, Cova Health Aware, and Cova HDHP. Anthem administers the medical, behavioral health, and prescription drug coverages for CovaCare and Cova HDHP plans. Dental benefits are administered by Delta Dental of Virginia. The CovaCare plan also offers buy-ups for additional dental, vision, and hearing services, as well as an out-of-network option. Aetna administers all benefits under the Cova Health Aware plan.
Who determines the state and employees' portion of health care payments for each plan that is available?
The Commonwealth of Virginia State Employee Health Benefits Plan is a self-insured plan. This means we pay our own claims. The companies we do business with, such as Anthem, Aetna, and Kaiser Permanente, administer the plans for us to keep costs down. DHRM sets the monthly premium cost based on overall claims expenses and the state's budget. Our health insurance costs are part of the state-approved budget each year.
Do state agencies have any influence on the health insurance providers or the cost?
No. The plan providers are under a procurement contract that goes out for bid every 5 years or so. The plans offered now are under contract for the next 5 years. You can always voice your opinion to your delegate or through the Virginia Governmental Employees Association.
I keep hearing about an annual open enrollment period. What is open enrollment and why is it important to me?
Open enrollment is the time frame when we are able to make changes to our health insurance without meeting qualifying mid-year rules. You can add or drop a dependent, change plans, and enroll in a flexible spending account for the new plan year. The plan year runs from July 1st through June 30th.
If I make changes during open enrollment, when will it become effective?
Open enrollment changes become effective July 1st. If the change impacts your cost, you will see that change on your July 16th paycheck.
Do I have to make any changes during open enrollment?
No. If you are satisfied with your current health plan and don't want a flexible spending account, you don't need to do anything. If you want a flexible spending account, you would have to enroll in that option during open enrollment. It is important to review your plan each year to see what may be changing. It is also important to update your dependent listing. If one of your dependents is no longer eligible or no longer needs coverage under your plan, open enrollment is the time to drop them.
What are the dependent eligibility rules?
Your spouse. You would need a marriage recognized as legal in the Commonwealth of Virginia, and ex-spouses are not eligible. Your natural or adopted children and stepchildren until the end of the calendar year in which they turn 26, regardless of whether they are married or single, live at home or not, and whether you support them or not. A minor child that you or your spouse shares legal custody, and the minor child is indicated in the other child exception. Incapacitated adult dependents, further defined under the dependent eligibility rules.
Why is it important to keep my personal address up to date?
Human Resources has the responsibility to ensure employees' addresses are correct in the benefits eligibility system. Your health care provider pulls your current address from this system when they need to mail out communications and explanation of benefit statements to you.
After open enrollment ends, what happens if I need to make any changes to my health insurance plan?
If you have a qualifying event such as the birth of a child, marriage, divorce, etc., you have 60 calendar days from the date of the event to make a change. Failure to meet the 60-day time frame removes your opportunity to make the change until the next open enrollment period. If this means that you should have dropped someone and you didn't, that could generate out-of-pocket costs for you. Contact your HR benefit administrator if you have questions about qualifying events.
What documents do I need to provide when adding a dependent to my insurance?
To add a spouse, you'll need a copy of your marriage certificate, not the one the preacher gives you, but the one from the clerk's office, and the first page of your federal tax return. To add a child, a copy of their birth certificate is required. To add a stepchild, a copy of the child's birth certificate and the first page of the federal tax return showing the parents filed taxes together are required.
How can I make changes to my health care during open enrollment or if I have a qualifying event outside the open enrollment period?
You can make changes through Employee Direct at www.edirect.virginia.gov or by completing a health care application and submitting it to Human Resources within the required time frame.
What is Employee Direct?
Employee Direct is a secure automated system that allows you to review your current plan selection, see dependents enrolled on your plan, and make changes to your plan. You can also verify your annual salary, see your total compensation, verify or change your home address, phone number, or email address. There is a job aid to assist you with using Employee Direct on the external VDOT's benefits page.
Healthcare providers say they pay based on usual customary rate. What is this?
The usual customary rate is the maximum amount the health insurance plan will pay a provider for a specific service. This is also the amount on which the deductible, if any, copay, and co-insurance are calculated.
How are my health insurance premiums paid?
Your health insurance premiums are split into semi-monthly payments and deducted from your paycheck pre-tax each pay period.
What am I required to pay a treating physician or facility?
When you receive medical treatment, you must pay the required copay if applicable. You pay this at the time of service. The treating physician or facility will then bill your health insurance provider. They will pay the allowable usual customary rate. Then they will send you an explanation of benefits statement which will show what the allowable charge was and what they paid. It will typically show any copay you were responsible for and what your remaining balance may be.
Am I responsible for the difference between the actual cost of services rendered and the usual customary rate?
Only if the difference between the actual cost and the usual customary rate, if you went to a physician or facility that is out of network and you don't have the out-of-network coverage. It is very important to verify that the physician or facility is in network prior to receiving services.
What is out of network?
Out of network is when you go to a hospital or doctor who doesn't accept your insurance plan. You can go to your plan's website to look up physician information or call the physician's office and ask if they participate with your plan.
What happens if I don't have out-of-network coverage and I go to a hospital or doctor who doesn't participate with my health plan?
You don't have coverage for the services. You would be responsible for the full cost incurred. The only exception is for emergency services. If you had a life-threatening emergency, those services would be covered.
Do I have out-of-state benefits?
As long as you go to a facility or doctor that is in your insurance network, or if you have out-of-network coverage.
Where can I find out more information about my health care plan to see specific details of what it covers?
You can Google VDOT benefits to get a link to all of our insurance providers' websites and plan handbooks. You may also contact your district HR benefits administrator.
What is a deductible?
A deductible is a fixed dollar amount you are required to pay each plan year before your health plan will pay for the remaining covered services during the plan year. Dental has a separate deductible.
What is out of pocket?
The amount of money you pay out of your pocket for certain allowable covered medical and behavioral health expenses during the plan year.
How long can I keep my children on my insurance?
Until the end of the calendar year in which they turn age 26. Disabled dependents can remain on your insurance after this point, but there is a qualification process that you must apply for through DHRM's Office of Health Benefits. Refer to the member handbook for further instructions.
What about a divorced spouse?
Your ex-spouse would need to be removed from your health insurance at the time the judge signs the final divorce decree. You have 60 calendar days from the date of the divorce to drop your ex-spouse from your plan. The effective date that the spouse no longer has coverage is the first day of the month following the date the divorce was final. Your ex-spouse will be offered extended coverage or COBRA as required by federal law. I hope this information was helpful. Here is a listing of beneficial websites to help you with more detailed information. You can always Google VDOT benefits to go to a website that houses up-to-date information on our benefits plans and a listing of VDOT benefit administrators.